You are listening to the Keeping It Juicy podcast.
Your main squeeze in nutrition.
Don't forget to subscribe so you can join us every Tuesday for a brand new episode.
Also, don't forget to add us on Instagram and Facebook at Keeping It Juicy Podcast.
All right, welcome to episode 72. Today we're specifically going to be talking about nutrition in crisis.
I mean, that's a real thing. So
we'll get more into it later.
Right. So before we do go into that, let's talk about new nutrition in the news, which, I mean, I just thought of something interesting. So basically this news article, it says COVID-19 pandemic may exacerbate childhood obesity. So basically what it's talking about is that public health scientists typically are predicting that school closures due to COVID-19 pandemic will exacerbate the epidemic that we're seeing in the United States today. And basically talking about how the COVID-19 related school closures will double the out of school time this year for many of the children in the United States and will exacerbate risk factors for weight gain associated with summer recess. So some of the schools and some of the school systems are not expected to reopen the school year, which is a big, big deal. And the experiences in Hong Kong, Taiwan, and Singapore suggest that social distancing orders, if lifted after short periods, will have to be periodically reinstated to control COVID-19 flare-ups, which might be happening in the U.S. as well. It's too early to tell just yet, but
see what if there is going to be flare-ups after states start to reopen. So we'll see soon.
Right. And while much has been written about the poor food and the lack of physical activity in schools in general, the data also show that children experience unhealthy weight gain primarily during the summer months when they're out of school. So unhealthy weight gain over summer school recess is particularly apparent for Hispanic and African American youth and children who are already overweight in the first place. So the authors actually presented several interventions for reducing risk factors for unhealthy weight gain during the school closures, which I don't think that should be the primary focus, but if you're worried, this is just some things to consider. So some school districts are offering students grab-and-go meals at school sites or via buses running along the regular pickup routes. And research shows that food insecurity is associated with unhealthy weight among children, and addressing food insecurity will likely have long-term benefits for child health in the first place. So as schools build a remote teaching capacity, they should probably make physical education a priority. So with home lesson plans for physical activity and or streaming exercise classes might be a good deal to have, but I'm sure you guys are all aware not all schools are created equally, I'm not the one coming up with the lesson plans. So that's just something to take into consideration, because with all this going on, not a whole lot of talk is going on with the children.
Mm-hmm.
So
I do have something to add on that note. One of my clients is a PE teacher, but she's a PE teacher for a private school. So she's a PE teacher, and there's 3 PE teachers for her school, and one teacher got a certain physical activity. She got yoga that she's supposed to teach remotely, and another teacher got cooking, which I think is really cool. So he's supposed to, teach kids how to cook.
Right.
But get this. It's a middle school, 600 students, 6 to 7 attend each class. So very, very poor outcome.
Yeah. So you have a lot of issues with that already.
Right, exactly. With kids not wanting to participate in PE has been a long-standing issue. Right. But now the issue is even though kids don't care to participate in PE, they're still not walking home from school. That is a big activity factor. Right. Or hanging out with their friends after school, walking to, a park to go hang out, doing things that kids do after school, or practicing football, practicing their sports. So physical activity for kids is severely impacted, even in addition to not getting their school lunches. And if the parents are uneducated about proper nutrition, the kids are already higher risk to become obese later in life. And like you said, now COVID-19 is just exacerbating that issue because it's basically an extended summer break. So
and the fact that during this time we'll probably see an increase in screen time as well, which is further discouraging them from moving in general.
So. Oh, exactly. Especially, that they're supposed to be doing distance learning. They're still sitting a lot.
Which distance learning has its pros and cons,
of course.
But just let us know how you guys, if you guys have come across this issue, or if you have any questions or concerns about it, definitely check out the article in the link in the show notes that we're going to attach. So I just thought this was interesting to bring up with everything going on.
We're going to see so many new cause and effect relationships that we never anticipated coming because of this. They said that more people, this is more of like an economic thing than a health crisis at this point. More people are going to go bankrupt from this than actually die. That's a side effect that we never really anticipated coming. So I'm really interested to see what effect obesity and childhood obesity is going to have from this too.
So with that being said, we're just going to do a quick update on our particular hometowns. So here in Southeast Texas, we have now 539 cases. So that's still a big jump from last time, and 24 deaths, which is another big jump. In regards to reopening, so technically Texas has begun the stages of reopening starting the past Friday. Basically, retail stores can open up a little bit, kind of like a to-go type of order or delivery type of order. So from store to your door, or if you call early on or do the order online, you can pick it up at the store rather than roaming inside. So that's, I think there's going to be more steps coming along, but that was one of the first steps that I heard about. The roads are a lot busier now, so that's something I want to point out. Not exactly happy about that, but it is what it is at this point.
I mean, people are going somewhere.
Exactly.
And then going to San Diego, our cases are now at 2,943, which is quite a lot. Our deaths have jumped to 111, and that's for San Diego County. San Diego County is fairly large, so we still do have a large portion of cases and deaths at this point. But kind of the new occurrences as of this week, a few cities in San Diego County have started to require face masks in covering or a face covering. My city, Chula Vista, is one of them. And as far as California, San Diego goes, there hasn't been any new talk of opening anything. We just haven't seen a downward trend yet. When I look at our, graphs of deaths and new cases and things like that, it's like big jump up, small jump down, big jump up, small jump down. So it's like increasing, but it's also holding steady at the same point. We just haven't seen a downward trend. And to get to phase one, you have to have 2 weeks of a downward trend. And we haven't had more than a couple days at this point, and then we see an increase. So I guess the only talk is that they want to open beaches as soon as possible. I mean, that would be great. What's really confusing is that you can still go to the beach, but you have to be moving. You can't sit, which to me is ridiculous. I think if you're moving around, you increase the chance of coming close to somebody. But if you're just sitting, sunbathing, and everyone's just kind of staying put, minding their own business, what's the big deal? But I don't know. It's odd how they're self-regulating people and the recommendations.
I don't know. I just not a fan of opening up public places just yet. It's just, I feel like everybody is such in a rush to get everything going, which I understand because there's a lot of people out of work, And like you said with San Diego, but the city where I live, it's still like there's still a steady increase. There hasn't been a decrease at all. So, which is still shocking to me that they're trying to reopen Texas, especially with that going on. It's just it's just a little frustrating because especially when you hear about other countries that are under much stricter policies, and the fact that they can't leave their actual place unless they go to the store or the good or get groceries. Whereas in America, people are still trying to walk around the block,
and
go to the
protest.
park, and protest, which is unheard of in other countries. Yet it just blows my mind to see that happening. So that's just my thought.
No, I agree. Like, we're all getting antsy. I get it. Um, but if we don't chill, we're gonna see big spikes somewhere. And I have heard the hospitals here in San Diego aren't quite as crazy as they were a few weeks ago, which is amazing. And our weather is starting to get really warm, and I've heard different things about saying like, oh, COVID will go into remission during the summer because it's almost like behaves as the flu does. You don't get the flu in the summer, but come winter and fall again, there's going to be another flare up. And I think we're just going to keep bouncing between these different levels of social distancing and self-isolation and things like that until everyone gets it. I don't know.
Right. So yeah.
Hope everyone's towns are doing well. Let us know what you think if your town is opening up, how that makes you feel.
Right.
You know how we feel. But we will jump into the bulk of our episode today, which is all about how dietitians' role in all of this is so important. But first, we are just going to talk about what does it mean to be on the front lines in general, and actually who are these people who are on the front lines. So honestly, it really just depends who you ask. We're going to try to cover all of our bases here. If we excluded anybody, sorry. But again, it kind of depends who you ask. But we're primarily talking about healthcare here. We're talking about physicians, dentists, psychologists, mid-level practitioners like nurses and assistants, infection control, quality assurance personnel, pharmacists, physical and occupational therapists and assistants, social workers, optometrists, speech pathologists, chiropractors. Again, depends who you ask.
Definitely depends.
I mean, I've seen a chiropractor. It helped me. It just depends who you ask.
It still blows my mind that dietitians were written low on the list, but that's just me.
Right. I mean, if seeing your chiropractor helps you, no hate there, but
it's not that immediate.
Yeah. Moving on.
Anyway.
Diagnostic and therapeutic technicians and technologies, and then there are hospital and laboratory personnel, which includes your accounting, your administrative, your admitting and discharge, engineering, epidemiological, source plasma, and blood donation, which is still a really important thing at this point. People still need blood transfusions. I keep getting emails all the time about, please come donate blood, please come donate blood. So they still need blood donations if you are healthy and available.
Right.
Appreciate that. And then food service, housekeeping, medical records, information technology, and operational technology. Dietitians, general public tends to call them nutritionists as well, but we're specifically talking about dietitians here, sanitarians, and then respiratory therapists. So that's a lot of frontline workers here. And then there are some other frontline workers that we want to give a mention to, our law enforcement, public safety officers, and first responders. I've heard recently that poison control reports have been up in the past couple days. So first responders, thank you for taking care of that. And then we have food and agricultural essential workers. This includes people in the food service industry as well. Then there are essential workers in the energy sectors, electric industry, petroleum industry, There's water and waste, essential workers, transportation, public works, and infrastructure. So there's still a lot of essential workers and people on the front lines out there. So I just want to give a mention to everyone out there. But for the sake of this episode, we'll be diving into the dietitian's role in this pandemic.
Right.
So first, just a brief background on COVID-19 coronavirus. We did talk about this in past episodes, but if you haven't listened to those or you're living under a rock, here you go. Coronavirus is a large group of viruses that can cause illness in animals and in humans, as we've recently found out. Some coronaviruses commonly circulate the United States and usually cause upper respiratory symptoms such as cough, runny nose, although some can cause some more serious illness. The 2019 novel or new coronavirus causes the coronavirus disease, also known as COVID-19. Coronaviruses like COVID-19 are most often spread through the air by coughing or sneezing, or through close personal contact, such as touching and shaking hands, touching your nose and mouth and eyes before washing your hands. Symptoms of COVID-19 include fever, cough, shortness of breath, and symptoms can appear anywhere from 2 to 14 days after exposure.
So, with that being said, what does nutrition have to do with COVID-19? So, although we don't have concrete evidence regarding specific dietary factors that can just generally reduce the risk of acute infections like COVID-19, we do know that eating a healthy diet, being physically active, managing stress, and getting enough sleep are critical to keeping the immune system strong. So basically do what you can, and in some cases, if you can spend some time in the kitchen or get some exercise, try to have fun along with it along the way. So that said, the COVID-19 health crisis is creating a range of unique and individual impacts from food access issues, which we've talked about, income disruptions, emotional distress, and beyond. So in regards to real-time COVID-19 present in everyday hospital setting, we see dietitians actually stepping up and playing a big role in providing the patient with the best ability to fight the virus and to recover. So you have to understand, for example, that if we take a patient that's in the intensive care unit, or also known as the ICU, they are more than likely sedated, ventilated, and will have nutrition, hydration, and medication delivered through feeding tubes. So feeding tubes are used to deliver the protein calories required to meet the demands on the body during critical illness. So in some cases, nutrition hydration will be delivered directly into the vein, which we'll go into. So with this in mind, we can see that dietitians are essential to ensuring that nutrition is delivered in the safest way for each patient. Dietitians are experts in assessing the nutritional demands on the patient, taking into account the age, gender, and other underlying medical conditions that the patient may have. So it's also important to keep in mind that not all dietitians also work in this arena like ICU. So it's just something important to point out, because we hear about a lot of COVID-19 patients being intubated or being ventilated. And when it comes to situations like that, it's really important to consider macronutrient breakdowns in that setting. And the only person that really understands how to provide the proper tube feeding is dietitians. So that's just something to keep in mind of one of the big roles. So let's say if you are a practicing dietitian or healthcare provider, please feel free to reach out to these resources, which we'll attach in the show notes. There is a link that is provided by the Academy of Nutrition Dietetics that has a whole list of resources that you can definitely check out.
Right. So now we'll specifically focus on the role of dietitians in the hospitals and the ICU. So as she mentioned before, the role of the dietitian is to develop, implement, and monitor nutritional strategies and interventions to meet the unique needs of critically ill patients in the ICU. Related to like coronavirus, the majority of the people who end up in the hospital are typically older and have underlying conditions. So the dietitian needs to really take into account all underlying medical conditions. And that's not easy because there's a lot of things that can go wrong in the body. So now we're just kind of going to go through a Day in the Life of a Critical Care Dietitian. It's a blog post that we'll attach in the show notes. And I just thought it was really interesting. I'm obviously not a critical care dietitian, so it's just kind of her example of what a day in the life looks like. So she talks about TPN, which is total parental nutrition. This means patients who may temporarily not be able to eat and drink as their guts aren't working properly, so they need to be fed directly into their veins. So a large number of patients in the ICU may be sedated and have breathing tubes, which means that they will often need to be fed using a nasogastric feeding tube. These tubes are inserted through a patient's nostrils and go down to the stomach. So this way we can give nutrition to a patient and help them recover while waiting for them to wake and go back to a more usual style of eating and drinking. So similarly to the TPN patients, we estimate what nutrition patients need to be given via these tubes, and then we advise the nursing staff and medical team on what to give in order to meet the patient's nutritional needs. So even if patients are awake and not sedated, they often have poor appetites due to their underlying condition and just the simple fact that they feel so unwell. So they often need specialist advice and support to help them increase their energy intake. So research suggests that at least 40% of patients are already malnourished when they are admitted into the hospital. So it is vital that we provide enough nutrition, such as calories and protein, as we mentioned before. To do this, we normally advise on high-calorie food, drinks, and snacks. When needed, we also supplement drinks which are high in calories, proteins, vitamins, and minerals. Also, it's important to understand that multi-organ failure is another complication often seen in critically unwell patients. Dietitians need to take into consideration the treatments and interventions that patients are having to ensure nutritional needs are met safely. The patient condition can change quickly during an ICU admission, and critical care dietitians have to be flexible and reactive to changes which inevitably and commonly occur. So in the show notes, we're going to attach a resource. It's from Aspen. So if you're a critical care dietitian, please feel free to check out that resource.
Right. So with that being said, we touched upon what happens in the hospitals, but what happens when you're not in the hospital, because there's still dietitians working in other places that are still going. And obviously it's important to note that not all dietitians do work in hospitals. So me, for example, I work in dialysis. So we're also known as nephrology dietitians who examine laboratory results, medication lists, and weight gains in conjunction with tools, action plans, and motivation to help patients feel better and just live longer overall. And dietitians do have nutrition and medication changes in mind all the time, along with the laboratory reports, and they have coordinated handouts and education needed to sell an action plan to the patient. So in this setting, believe it or not a lot of patients are open to the help. So a lot of patients that are in dialysis are sick, but they're not sick enough to be in the hospital, if that makes sense. And they may not feel like they're sick enough. So with that being said, they're not going to open us in open arms. That's just not the case. That's a bold-faced lie. I mean, dialysis patients are probably the most stubborn patient populations to work with. I'm going to be honest. And oftentimes patients are not going to feel well, they're tired, and they're trying to comprehend the medication or treatment changes recently made by their doctor for another health issue that they're trying to manage as well. So not considering that it may be affected by what they're already eating or drinking. So they think it's medication changes over what they're eating. So with their mind racing about their other health conditions and personal issues, sometimes the last thing they worry about is how they can change their current nutrition intake. So in fact, the nutrition choices that they make are sometimes the only aspect of their lives that they may feel that they have control over. So with that being said, we also see that there's a problem here. They're also high-risk patients. So what that means is that those are on dialysis have a higher risk for severe disease if one of them were to contract COVID-19. So if you guys have seen the news at all, you can see that there is a higher proportion of those on dialysis that have suffered from COVID-19 and have a tendency to have a higher mortality rate because they have so many other comorbidities going on. So I mean, I can only take care of the patient in the dialysis center. And that means they're not sick enough to be in the hospital. But once they're sick enough to be in the hospital, then that's at that point, that's out of my hand, and that belongs to the dietitian at the hospital. And something else that I wanted to point out with COVID-19 as we gather more data is that there have been recent reports of non-elderly adults infected with COVID-19 who have developed acute kidney injury, also known as AKI, which is different from ESRD, because ESRD, once you have dialysis, and we see a trend of your kidney going down, then that's it. AKI is just a sudden loss of kidney function. These adults typically don't have underlying medical conditions. So with proper treatment, including dialysis in severe cases, AKI can be reversible. So AKI is not the same as CKD, also known as chronic kidney disease. So that's another thing to consider, which CKD will eventually lead to general kidney failure. So neither CKD or CKF, I know that's a lot of acronyms, are reversible diseases. So detecting proteins in our blood in urine labs is an early sign of kidney involvement in people with confirmed COVID-19. So approximately 3 to 9% of patients with confirmed COVID-19 develop an AKI, with many requiring dialysis treatments. So regardless of age, people with AKI are at increased risk of developing some serious complications from COVID-19. It's recommended that recovered COVID-19 patients who had an AKI should be seen regularly by a kidney doctor, because their risk of developing chronic kidney disease is higher than others. Also, COVID-19 patients who do not develop AKI but who have blood and or protein in their urine should be monitored, since they are at increased risk of developing chronic and end-stage kidney disease. So even I want to say one of the doctors that actually rounds at my clinic, he actually goes to the hospital at the end of each day, because I think one of our hospitals here on the 6th floor is entirely dedicated to COVID-19 patients, and he sees all of them because of this going on, because of this phenomenon going on with AKI. So there's just an increased risk for kidney disease. So that's just something to keep in mind.
Really interesting.
Yeah, and if you saw in the news at all, areas such as New York are actually facing an increased need for dialysis machines to make up for the dramatic increase in demand. So
first it was a scramble for ventilators. Now it's a scramble for dialysis machines.
Right. So we're going to be screwed on a lot of ends.
Wow.
So this is something that no one has really talked about or really thought about until it started happening. And the funny thing is, I saw another news article that basically there was an issue of the patient has COVID-19, they're in the hospital. Typically, when it comes to chronic kidney disease, before dialysis, you should give them as little protein as possible, because if you give them more protein, that's going to cause more damage for the kidneys, leading them into dialysis. But the thing, though, they found in these patients is they gave them the most minimal protein ever, but they still ended up having kidney damage. So that's the weird thing. So now we're on this tricky balance between how much protein should we actually get.
Right. And it's
So
not like there's, a reference of how much
right,
protein to give someone who has developed AKI from coronavirus, because
right,
we don't know, because
right,
there's no, wow, a
right. So
biological phenomenon.
right. So this is I mean, in this case, higher protein may be warranted because there's a shit ton of other stuff going on as
Right.
well. But no, from what I've gathered, no physician wants to go through with that. But I don't know. It's just something that I thought was, I mean, it's just something new that I haven't really come across. Now that I'm hearing reports about this,
Well, every
it
day
blows my
there's
mind.
new stuff. which makes me mad that states are reopening when there's new stuff every day.
Right.
But that's beside the point.
Right. So, I mean, this blew my mind when I read it. I'm not sure if any of you guys have come across this or have more information about the nutritional needs, because even if you see here, dietitians at the hospital have a delicate balance between choosing what type of macro needs that the patient actually do have, because in critical care situations, it makes a big difference on the type of macronutrients that you give the patients.
Right. It's tricky. It's all new, you know. Every treatment, you know, is a piece of data that's just going to teach us how to deal with this.
Right.
But we don't know at this point. But that's a really interesting association, because we've known that patients on dialysis are just higher risk for a lot of things. That's just because of you know, their condition. But now we know that they're even at higher risk for coronavirus, and the reverse too, you know.
The reverse can happen too.
Yeah, so take care of your kidneys, drink your water. So now we will dive into the role of dietitians in cancer, because cancer patients are also a relatively high risk population as well. So, oncology dietitians specialize in helping patients with cancer adjust their nutritional intake to optimize health and minimize side effects caused by cancer and cancer treatments. So, good nutrition in cancer patients has been linked to better chances of recovery and lower incidence of remission. So, the field of oncology nutrition typically focuses on personalized nutrition plans to help patients deal with the unique challenges of their illness and treatment plan. With the right dietary guidance, a patient's nutrition can be optimized to support treatment and combat symptoms and side effects. Additional benefits include preventing and combating malnourishment, preventing the deterioration of lean body mass, fortify the patient to better withstand or tolerate treatment, and reduce complications and related illness, bolster strength and energy, fortify the immune system, boost recovery and speed healing, and just overall boost quality of life.
Right. And a lot of times people also forget that sometimes, like, if you're, let's say you're a cancer patient, or you're a dialysis patient, or you're a patient in ICU, sometimes you can be that one lucky patient with all of these combined. Like, I don't know, because
and you can have diabetes as well.
Right. So in my experience, I've had a handful of patients that are going through cancer treatments right now, and they're on dialysis, and they have diabetes, and they have other stuff going on. So that's just something to take into consideration as we go through COVID-19, because we hear a lot about the front lines, and we hear a lot about the essential workers, but no one really talks about, like, I'm not crying over here, but
yeah,
it's just something important to bring up, that a lot of people don't really think about. So I'm sure.
right, the role of dietitians in this pandemic, because in general, dietitians don't tend to get the you know, attention that they deserve.
Well, I mean, it's not like we need attention, but
Right.
it's important to point out that there's a lot more going on behind the scenes that people don't really think about, like,
how complex nutrition actually is in all of these different conditions.
Right. And how just there's a lot of other essential workers in hospital settings that play just as much of a vital role, as we go through this pandemic.
Definitely a collaborative effort.
Right. So if you guys have learned anything new from this episode, or you're wanting more information or anything, please reach out to us. We have attached some links, and which we'll attach in our show notes, so be sure to check those out. And yeah, so.
Or if you're a frontline worker and want to share an experience with us, please let us know.
Yes, please. So with that being said, let's kind of close the episode out with our new with our social media shout out of the week, and it goes to Abby Adams 6119, and she is an ODN, and her bio quote, which is my favorite, is "eating my way around the world," and I felt that too.
We like that.
So we do appreciate your support, and if you want to be our next social media shout out, definitely keep liking or commenting or basically reaching out to us. It's just as good too, and we do appreciate it.
Yes, we appreciate all the love and support. So thank you guys, and we will catch you in the next one.
Bye guys.
Bye.
Have bleach on my hands. God damn it.
Thanks for listening to the Keeping It Juicy podcast.
Your main squeeze in nutrition.
Don't forget to subscribe so you can join us every Tuesday for a brand new episode.
Also, you can find us on Instagram and Facebook at Keeping It Juicy Podcast.
We'd love to hear from you, so please leave us a review.
5 stars, no less.
On whatever platform you're listening to, or send us an email at keepingitjuicypodcast@gmail.com.
Or if you have any topics you'd like for us to touch upon, shoot us an email. Until next time, don't do anything that I wouldn't do. Wow. Similarly.
Similarly?
Yes.
Similarly. How do you say it?
Similarly.
Similarly?
Yes.
Similarly.
Oh my God, just go.
In a similar fashion. Just kidding. That's a hard word. Similarly.
You've been in quarantine for too long.
Pretty much.